Pro-inflammatory cytokines. So here we are looking at IL-1. So this IL-1, what it does is induces it induces the inflammation. So induces inflammation, it induces fever as well as the sepsis. And what it does, it activates the TNF alpha as well as the proliferation as well as the differentiation. So this differentiation is of the T, B as well as the other cells, as well as there is a bone marrow, that is proliferation that is taking place. Next what we see is the IL-2. So in case of the IL-2, it promotes growth as well as the differentiation. So growth and differentiation of the T as well as the B cells. And next what it does is there is a cytotoxicity of the T as well as the NK cells. And there is secretion of lymphokines. Next, if you look at the IL-6, it promotes the B cell stimulation and also the differentiation. And there is a mediator of the acute phase reactions, and there is a mediator of the acute phase reactions as well as the IgG production. Next, what we are seeing is the IL-8. So in case the IL-8, there it attracts and activates. It attracts as well as the activates the neutrophils. The neutrophils in the inflammatory regions, as well as there is a neutrophil chemotaxis. Next, what we see is the IFN alpha. So in case of the IFN alpha, so here it is it has an antiviral. It is again immunoregulatory. That is what it does. It enhances the MHC class 1. Next, the NK cell activity as well as the anti-proliferative. Next, we look at the TNF alpha. So in case of the TNF alpha, so what this does, it activates the macrophages and as well as the cytotoxic cells. And then it also induces the cachexia as well as the acute phase proteins and cytokines as well. Cytokines such as the IL-1 and the IL-6.